Hi, I'm Gautami Tripathi and I will be presenting our work. I know I have this till my last breath, Unmasking the Gaps in Chronic Obstructive Pulmonary Disease Care in India. This work is advised by Professor Pushpendra Singh. COPD is an incurable chronic respiratory disease that results in restricted airflow and respiratory issues. Amongst the chronic respiratory diseases, chronic obstructive pulmonary disease takes the lead as the most prevalent yet underdiagnosed and underestimated condition, accounting for almost 6% of total global deaths, which makes it the third leading cause of death globally. India, which is a home to 18% of the world's population, contributes a significant 32% of the global DALYs caused due to CRDs. SIGCHI researchers have explored multiple aspects of CRD care, including digital health monitoring, wearable devices, telemedicine, telehealth solutions, medicine adherence, behavioral interventions, gamification, and self-management. Most previous studies have also delved into the identification and evaluation of the respiratory patients by employing continuous monitoring techniques. A majority of the data and the research findings in these studies is derived from developed high-income countries, while over 90% of the deaths attributed to CRDs like COPD actually happens in low and middle-income countries. Fueled by large population, limited healthcare facilities, and rising pollution, the impact of CRD is adverse in India, and it is likely to worsen in the coming years. As of 2022, India held the 8th position amongst the most polluted countries globally, with its capital city New Delhi consistently topping the list as the most polluted capital for 4 consecutive years since 2018. Despite its rising prevalence and significant impact on India's healthcare system, COPD continues to be under-researched. This lack of research leaves crucial gaps in our comprehension of the risk factors, diagnosis, socioeconomic implications, and the effectiveness of prevention and management strategies which are tailored to the Indian population. Our work fills a significant gap in this existing literature where we discuss India's specific challenges surrounding COPD care. We ask, what is the current state of COPD care in India and how can technology-based interventions support COPD care in India? To answer these questions, we conducted 2 surveys, one with general public and another with doctors, and semi-structured interviews over a period of 6 months. Our public survey targeted the Indian population over 18 years of age and Indian doctors to assess the level of awareness and knowledge about COPD in India. We also conducted 13 semi-structured interviews with doctors, COPD patients, and caregivers to understand the diverse perspective of the various stakeholders. The data from our surveys and interviews was triangulated to structure our findings. Our study indicated a notable insufficiency in understanding COPD. Every patient and caregiver we spoke with shared one common experience of not having any prior knowledge of COPD. In certain instances, the patients were undergoing a different treatment and their actual diagnosis occurred quite late, with some individuals remaining unaware of their condition for as long as 4 to 5 years. We also observed a troubling trend of late diagnosis amongst the COPD patients. This delayed diagnosis or misdiagnosis or misunderstanding of the symptoms sometimes leads to serious consequences where the patients miss out on the early treatment and care. One of the caregivers regretted of not knowing about the condition of his patient earlier, as he believed that if known earlier, the patient could have been saved. The lack of awareness and the incurable and lifelong nature of COPD prompted patients and their caregivers to resort to experimentation with the various management techniques and treatments. This sense of urgency and experimentation emerged from the desire to explore any possible means of treatment. This highlights that how desperate the patients and the caregiver were in the pursuit of treatment and management for COPD. As the patient gained familiarity with the disease and its management, they accepted their condition and surrendered to their misfortune. The acknowledgement of COPD as being a part of their life, paired with the confidence in managing the disease independently, led to the neglect of regular checkups, follow-ups, and a careless attitude amongst the patients. Living with COPD and its symptoms challenges the patient's sense of identity and self-image, leading to an emotional response which were further intensified by the disparity between the patient's daily struggles and the apparently effortless activities of the other individuals. This often led to individuals perceiving others as normal while viewing themselves as distinctly different from others. Our study also highlighted the prevalent issue of failure to medicine adherence and treatment plan amongst the COPD patients and caregivers. Lack of a supportive community for COPD patients in India compels the individuals to resort to Google for symptom-related queries and search. We observed that there is a strong demand for technical solutions to improve COPD management amongst the patient, caregivers, and doctors. Moving forward with these findings, what does this mean for researchers in the HCI domain? Owing to the unique demography, environmental challenges, and access to healthcare services, India has a high burden of COPD, thus underscoring the urgency of targeted interventions. Our findings and data emphasizes that there is a need for targeted interventions aimed at raising awareness about COPD to reduce its prevalence and burden. Such initiatives can not only promote empathy but also enhance the understanding within the general public. We observed that patients do not navigate their disease management journey alone, but are accompanied by doctors, caregivers, while also being influenced by social factors like stigma and environmental factors like air pollution. Social interventions in the form of support groups, whether online or offline, can provide mutual understanding and shared strength in such cases. We observed that in the absence of self-management and monitoring technologies, majority of patients are opting for reactive management approaches. In these cases, ICT-based solutions can assist the patients and caregivers throughout all the phases of their COPD journey. We invite you to read our paper, which has more suggestions and findings on this topic. With that, we end our presentation. Thank you.